Thank you for joining Washington University Orthopedics to learn more about shoulder replacement surgery, also known as shoulder arthroplasty. This video series is intended to help you prepare for surgery and plan for your successful recovery. This is the fourth video of a four-part series. The goal of this video is to discuss the restrictions after surgery, important procedures and events to consider after surgery, and optimizing your recovery. Other videos in this series cover what shoulder replacement surgery is and how it works, the medical workup and necessary steps to complete before you have surgery, and the events that occur on the day of surgery and during your hospital stay. Let's discuss what happens after you are discharged and begin your recovery. After your shoulder surgery, you will use a sling to protect your shoulder. The types of slings that are used after shoulder replacement surgery are different for anatomic and reverse replacements. With an anatomic replacement, you will receive a sling with no pillow. With reverse replacements, you will typically receive a sling with a pillow for additional protection. It is important to follow the sling instructions you learned while in the hospital. Do not bear weight on the arm or reach behind you. For all types of arthroplasty, you can spend some time out of the sling as long as you are sitting or resting in bed, but you should have your arms supported on pillows. You should wear the sling when you are up and moving and at nighttime. Pay attention to your restrictions. No weight bearing, do not reach behind your back, and no lifting more than a few pounds with your hand. Blood clots or deep vein thrombosis can complicate any type of joint replacement. Even though there are risks of blood clots are less with shoulder replacement than hip or knee replacement, these can occur. Your general activity level after surgery are more important than medications to prevent a clot. You should walk short distances around the house at least 8 to 10 times each day. To further prevent blood clots, most patients are placed on baby aspirin twice a day for 2 weeks. Higher risk patients will be placed on a stronger blood thinner medication as needed, usually for 4 weeks. Always wash your hands before and after caring for your incision. Your sutures are dissolvable and mostly under the skin. The incision is reinforced with tapes called steri strips. If you have a bulky dressing over your incision, remove this on day 5 after surgery, but keep the steri strips in place. You may shower after day 5 and after the dressing is removed. If you have a clear dressing over your incision, do not remove until your first post-operative visit. Clear dressing is waterproof. Don't soak your incision in water or submerge your shoulder in the bathtub or a pool. After dressing removal, you may notice bruising and swelling. This is normal. Often the bruising will track down the arm into the chest or down your torso due to the effects of gravity. Family and friends should clean their hands with soap and water or an alcohol-based hand rub before and after visiting you. If you do not see them clean their hands, ask them to clean their hands. Ice therapy is very helpful after surgery to reduce inflammation and pain. We recommend that you use ice therapy continuously for the first 3 days after surgery. After this period, use cold therapy 2 to 3 times per day for about 30 minutes. A good time to do this is following your exercises. Application of cold therapy is a good idea prior to sleep. Pain relief at home is provided with a combination of ice therapy and medicines. The first line of treatment for pain should be cold therapy and prescribed NSAIDs. Make sure to follow instructions for taking prescribed and over-the-counter medications. Narcotic pain medicine should only be taken when you feel that the pain is intolerable and interferes with your daily activities. It is strongly recommended to reduce the frequency of use of these medicines as your pain improves, as these medicines have many side effects and have an addictive potential. Most patients can cut back on these medicines within 3 to 4 days after surgery. These medications are most helpful when taken prior to sleep. When you are running low on these medications and need a refill, please give us a notice in advance so we have enough time to fill your request. If this falls on a Friday, we need to hear from you before 10 a.m. to make sure you are covered for the weekend. Sleep can be difficult after shoulder surgery. It is difficult to lay flat and important you do not sleep on your operative shoulder. You can either sleep in a recliner or in a bed reclined on pillows. You should wear your sling when sleeping. You will rest better if you place a pillow behind your elbow when resting, as this helps prevent your arm from falling backwards. Remember to avoid weight bearing or pulling with your operative arm. Ice therapy is helpful prior to sleep. We encourage you to stay active after you get home from surgery. Walking is important to prevent blood clots and pneumonia, but do not drive until your first follow-up visit. If your job is not physical, you can resume working once your strength and concentration have improved. You can remove your sling for computer work when you feel capable. Physical therapy is an important part of your recovery. Therapy is started at different time periods after anatomic and reverse replacement. After 6 weeks, the front rotator cuff tendon is healed and outpatient therapy is started. For reverse replacements, physical therapy is generally started at 3 weeks following the surgery. Before your first follow-up visit, stay focused on the exercises you learned in the hospital. It is important to keep muscles strong. Please refer to the exercises, therapy instructions, and videos provided by your surgical care team. There are several signs and symptoms that you should watch out for after surgery. If these occur, please call the office of your surgeon or the after-hours phone number provided. These include a fever above 101 degrees, if you notice drainage through your bandage, continual drainage after the dressing is removed, or any part of your incision that is open, a foul odor of the incision, extreme swelling around the shoulder, under the incision, or down the hand. Swelling in the hand is common and should be treated with elevation, but worsening swelling should be reported. Other things to watch out for include shortness of breath, persistent nausea, vomiting, or diarrhea, numbness and tingling in the arm, shoulder or arm pain that is not controlled with pain medicine. We look forward to treating your shoulder problem and providing the highest level of patient care to relieve your pain and improve your shoulder function. Thank you for completing this Washington University Orthopedics Education Series to prepare you for surgery. You or your joint coach may refer back to these videos at any point in your patient journey. Adhering to your care plan and having assistance from your joint coach will be instrumental for your recovery. Do not hesitate to contact your surgeon or other care team members with questions or concerns. Thank you.